Again, welcome to your health. My guest is Dr. Paul Moore, and Dr. Moore, over the past few weeks, we've been talking about the heart, some signs or symptoms you may be having trouble. Well, if you are having trouble, like in my case, I had to have surgery, but there are different ways that we treat different conditions of the heart. Can we let our viewers know just some of the different ways?
There are various treatments. You mentioned surgery. In people who have blockages in the arteries, bypass surgery is a very common way of treating that condition. With bypass surgery, if you develop a blockage in a segment of the artery, the surgeon actually goes in and creates a path around that blockage. Doesn't remove the blockage per se, but creates a path around that blockage so that blood can flow to where it needs to go to supply the heart muscle. So bypass surgery is one treatment. Other treatments, medical treatments, are very, very good. In fact, bypass surgery has become not less frequent necessarily, but the rate of growth of bypass surgery has dramatically been reduced over the last 15, 20 years as a result of good medical treatments. Medical treatments include lowering your cholesterol, getting your cholesterol down to where the progressive accumulation of cholesterol plaque in the arteries is stopped, and you can do that by getting your cholesterol low enough. Other treatments include controlling blood pressure is very important. Exercise is actually an excellent treatment for people who have cardiac disease. Not if they're unstable, not if they're in a bad situation in terms of blood flow, but exercise is an important adjunct to everything else we do. Exercise, I tell my patients that we can do all of these wonderful things: bypass surgery, balloon stent type work, powerful medications, but in terms of making patients live longer and live better, there's nothing better than an exercise program. And we're actually in the fitness center right now.
That's
appropriately. I mentioned stents. Stents are a common way of treating patients who have blockages.
And that's almost like taking something like this and just pushing it and holding it open, is that right?
That's correct. The stent just provides a scaffold to keep the artery open. Back many years ago when I started all this, we didn't have stents. We had balloons, and we would stick the balloon into the artery and create a bigger channel, but then it frequently would rebound and restructure so that the vessel would re-narrow at that site. So stents have provided an excellent way of keeping that artery open. But stents aren't perfect, and they're better used for people who have fewer blockages in fewer arteries. So one or two vessels blocked up are okay to treat with stents. If you've got extensive blockages, it's probably better to do bypass surgery. Studies have shown that the more complete the revascularization is, the better off the patient is. And bypass surgery does more complete revascularization.
Okay. Then we also talked early on about we call this thing in there that you replace every now and then, pacemaker. Okay, you put in a pacemaker. You said our body comes with a natural man-made pacemaker, but then when is that necessary? When it's not
pacemaker
functioning?
is necessary when that natural pacemaker that we're born with is just not working as fast as it should. So it doesn't respond to our activity level the way it should. In other words, we may get out and try to do some work, and our heart rate simply doesn't get up to accommodate the needs of our skeletal muscle. So if that's the situation, our heart rate is too slow, and that's fundamentally what a pacemaker is needed for, is when your heart rate's too slow. Now, we also have devices called implantable cardioverters, and a lot of people have those, and those devices are meant for people who have certain kinds of, usually a tachycardia, the heart rate's going too fast, and that defibrillator can shock you back into a normal rhythm. But more commonly, they get pacemakers, and that's for a slow heart rate.
Good, and that's normally, that'll take care of it usually without any problem.
Very well. Good. We have very sophisticated electronics, very sophisticated devices, the pacemakers are these days.
Well, good, thank you. Next week we're going to get you to come back and let us know how to maintain the healthy heart. You start off good, let's keep it good, right? And we'll be right back right after this.